evening and welcome. You are watching The Chase, Zimbabwe's current affairs program that you should be watching tonight. I am Faith Nyaude. It has been a couple of months since the first cholera outbreak was recorded here in Zimbabwe. This is not the first outbreak in Zimbabwe. The country had another one in 2008. According to the World Health Organization, as of December 2008, a total number of 26,497 cases, including 1,518 deaths, had been reported by the Ministry of Health in Zimbabwe. The 2008 outbreak is considered the largest ever cholera epidemic recorded in Zimbabwe to date. Now, the latest statistics from the ministry show that new cases have been arising and cholera might potentially become an outbreak as well, if not addressed. It is noteworthy to point out that cholera is not the only worry that the country is facing at the current moment. To help us unpack these issues in studio tonight, I am joined by Dr. Piri from the Ministry of Health and Childcare. We also have Mr. Victor Nyamandi, Mr. Paul Chinakidzwa, Dr. Vere from the city of Harare, who is joining us via the phone. We also have Dr. Edwin Mzingwane, who is the Director of Health Services for the city of Bulawayo, who is going to be joining us via Zoom. Join me and my guests tonight live on The Chase as we discuss cholera issues and so much more. We'll be right back. Welcome back. You are watching The Chase, Zimbabwe's premier current affairs program. Our discussion today is cholera back to haunt Zimbabwe? I'm your host, Faith Nyaude. Now, to our viewers, you can join us via our social media platforms, Facebook page, that is Zimpapers Television Network, or on X, formerly known as Twitter, at ZTN Prime. We would love to hear from you. Do send through your contributions. Remember that all views that are expressed on this program are those of our guests, and they do not reflect those of Zimpapers 1980 Private Limited or those of ZTN Prime. Let us cut directly to the chase. Cholera is considered the Grim Reaper, quote unquote. Now, first of all, we need to know what is the current situation regarding the cholera outbreak. What are the numbers looking like so far? What are the number of deaths? And also, what are the hotspots? Is this country going through an outbreak, or is it being confined to certain areas or cities? I will start with you, Dr. Piri.
Thank you very much for having us, and we thank you for giving us this view to share with you the statistics of the current cholera outbreak that Zimbabwe has been experiencing. As of March 2023, a total of 6,217 cases, cumulative cases, have been reported throughout the country, and a total of 127 deaths have been also recorded since March 2023. The districts that have been affected are totaling 43 throughout the country. Manicaland is the worst affected, which has reported 2,834 cases and 27 deaths. Harare province has reported 1,713 cases, which is the second in following Manicaland. Masvingo is third, that has reported 558 cases, and Mat South has reported 352 cases. In terms of the new cases that have been reported as of 1st of November 2020, as of yesterday, 103 cases have so far were reported yesterday. These are new cases. For Manicaland, it has reported 27 new cases. Harare province has reported 23 new cases, and the Masvingo also reported 9 new cases as of yesterday. These are the statistics that we have so far.
Now, Dr. Vere, it seems like Harare seems to be the breeding ground for most of these outbreaks, as it looks like. What is the current situation like from your point of view?
Okay. Thank you very much for having me. The 1st of November, that is yesterday, 1st of November 2023, we had a total of 94 cases since the 23rd of September. Out of the 94 cases, 20 6 cases are confirmed cases, whilst we also experienced 1 death since the 23rd of September. So what apparently happened with Harare is that we had an outbreak of cholera earlier on in the year, from April to July, and we declared the cholera outbreak over. So this is why you had talking about the Harare has got 1,000 and something cases. So those cases include those that we recorded earlier on in the year. But within the current outbreak, we now have recorded 94 cases. But what is apparent is that I think of late, the past few days, we have seen the rapid increase in the number of cases, especially confirmed cases, where we've recorded around 12 cases in the past 5 days, which is a pretty rapid rise compared to the previous 2 weeks since the 23rd of September. So this is the current situation. We obviously feel that probably the few rains that we've received have already started impacting on us negatively, and also I think the outbreaks around the country, because from the 6 cases that are confirmed cases in Natal, a significant number of these are imported cases from Mondoro, Buhera, the other areas. So quite a significant number are imported cases.
Okay, Dr. Ferrer, we'll come back to address this rapid rise in cholera cases. We just want to hear from Dr. Mzingwane in Bulawayo City. What is the situation like on that side?
Well, for the city of Bulawayo, I would say we have been relatively spared, because since February, when the first case was reported in Chekutu, we have only recorded 12 suspected cases. 3 of them have turned out to be rapid diagnostic test positive, and 3 were confirmed cases. And of the 3 cases that were confirmed, 2 had a direct history and an epidemiological link with Manicaland, while the 3rd one, there was no established history of where he would have gotten the cholera outside of the city. Otherwise, this is where we are. All of the patients were discharged and sent home. We've had 1 suspected death, but it turned out to be negative to all the tests. And this is the situation. So we've only had 12 cases in all.
Now, Dr. Sibanda, we'll come back to you. You did say something about, the links that these diseases might have. We just want to hear from the gentleman right here in studio. Could the local environment be harboring this cholera pandemic, the pathogens, of course, that do cause cholera?
Yes. Let's first start with what is there in place, because the drivers of cholera are mostly unsafe water, then burst sewer pipes. So that means if there is no safe water and the water is contaminated by the cholera vibrio, which is the bacteria that causes cholera, then it becomes a driver, because people then have access to the cholera vibrio. You know that there is inadequate water in Harare due to our shortage of the capacity of our dams, and that our water is highly polluted. It's a pollution from all the sewage coming from Shitumbwiza, from Rua, and even from Epworth. It's all getting into Lake Chiwero, and the treatment then should be intense. But along the way, we've got sewer pipes that are also contaminating our water, our rivers, and people are getting most of their water from wells. For those that cannot afford safe water, that means they've got access. Then our surfaces then become contaminated, because the only water that we have access to, which is in the wells, is contaminated water. Most of our bores, because the underground water is also laced with sewage, are contaminated with E. coli. And as a result, a lot of our people are affected because our environment is contaminated.
So this basically means that Zimbabwe is a breeding ground on its own. It doesn't have to be linked with other countries for it to be having these cholera diseases.
We wouldn't say it's a breeding ground, but conditions obtaining at the moment favor the multiplication of the Vibrio cholerae. But you also realize that a lot is being done to ensure we control that through efforts of government and stakeholders.
Now, Dr. Very, let me come to you. In the year 2008, Harare, particularly in the Buliriro suburbs, that is in the southwest, accounted for the majority of the cases that were reported. These were followed by Beit Region, Matabeleland South, as well as in Mudzi and Mashonaland East. Fast forward, we're now in the year 2023. Buliriro again is back, and they are the epicenter of this outbreak. Why is it that we are continuously having these outbreaks in Buliriro, and what are the solutions that are in place to prevent such outbreaks in these areas?
Okay, so thank you very much for that very important question. That our listeners can actually understand what is driving this. So we note that as Ms. Nyamande has just elaborated that Harare is facing challenges of water. At the moment, Harare is only able to produce a quarter of the required municipal water. So it means most suburbs will not have adequate water, potable water and clean water to use. This means that areas like Buliriro or Glenview, where we have traditionally had outbreaks, are obviously at even greater risk. What is found in those particular areas is that the underground water is contaminated with E. coli, as the previous speaker has rightly said. And because of the shortage of water, people then start to use water from their wells, even for drinking. Some people do not even treat the water. So this is why we continue to get outbreaks in that particular part of our Buliriro, because the underground water.
Okay, Dr. Very, let me just cut you there and just bring it back here in studio. I do understand that as the Minister of Health, while you do not have any direct links with what other ministries do in service provision, do you might particularly have a hand in making sure that the water that is being provided to the people is clean, where the bores are being drilled, is it safe for consumption, and so on and so forth?
Yes, we carry out, if you look at the Public Health Act, it gives the Minister of Health the mandate to carry out water quality monitoring. So we monitor the water for quality. That means its safety. And we inform the public so that they are aware of the status of their water. So all the water reticulation systems, say treated water from Harare, even from protected wells, from boreholes, we monitor. And we have got officers, more than 3,000 on the ground, that monitor the water. Where the water is positive, or where there are indications that the water is contaminated, maybe by microorganisms or by chemicals, we have got the government analyst laboratory, which will then carry out confirmative tests. So that's one of our duties that we have to do. Mainly, this is the duty of government, but we have also private players who come in, and also probably for individuals who need to have their water verified, they're also coming and provide the same services.
So now we do understand that the issue of service provision, collection of refuse is one of those issues that do contribute to the cholera outbreaks happening. Let's just move over to Bulawayo, to Dr. Msingwane. If I should ask, the first case of cholera was reported around June 2023. There was a student at Mzilikaze High School who was admitted to Thorngrove Infectious Diseases Hospital. What ways have you come up with to try and intensify the battle with cholera, especially in high-density suburbs right there in Bulawayo?
First, let's refer to that particular case of a student who was at Mzilikaze High School. The student was residing outside of the city and had come to the city for schooling purposes only, but by residents lived outside the city in the province of Mat North, Umguza district to be specific. But that aside, we have got a rapid response team that is very, very active. Since COVID-19, it has remained active and we have not deactivated it or de-escalated. If anything, we've been escalating whenever we have got a diarrhea outbreak, because the city is facing water challenges. And unlike Harare, and just like Harare, we are facing water challenges, but the causes are different. They have challenges of reticulation and treatment. We have challenges of absolute water availability, raw water availability, and occasionally challenges of pumping. But that aside, we have got that active team, a rapid response team, which is ensuring that whenever we have a diarrhea case, we closely monitor it, do active contact tracing, and try and bring it under control in the shortest possible time. We have got tests and we've got partners on standby who have come handy whenever they are required. And they've done a good job, I should say.
Now, I understand that the current situation, like is always the case, is closely linked to the lack of safe drinking water, poor sanitation, declining health infrastructure. The factors are a lot. They go on and on and on. And these are the continuous factors that we hear every single time. Harare and Bulawayo are probably the biggest municipalities that we do have in this country. Dr. Vere, do you believe that the shortage of water, non-collection of garbage in high-density suburbs, most of them that is, and raw sewage that is flowing across the streets are the main contributors and causes of this outbreak? Can I get your comment on that?
Yeah, exactly. You say it very correctly. That those are the breeding grounds for diseases like cholera and typhoid. Remember, we also have got typhoid around. So those are the breeding grounds where there is no water, there is garbage all over, and also the issue of sewage. Because remember, this cholera also survives in the sewer. So the moment that there is a sewer burst and people are exposed to it, then cholera can start to be transmitted from there, as well as diseases like typhoid. So yes, you are very right. Those are the breeding grounds for cholera, and obviously what we then encourage people as we make efforts to clear the garbage as City of Harare, to clear the garbage, to repair the sewer pipe, and do other interventions. We encourage our residents to make sure that they treat water, regardless of especially drinking water. Because what you've noticed is, I said earlier on, that even boreholes in Harare are contaminated. So there's a tendency of people thinking that, say, borehole water is safe, but unfortunately in Harare that's not the case. You discover that the majority of boreholes that we've tested actually were contaminated with E. coli. So treat water regardless of source. And at the moment, unfortunately, we do not have adequate supplies of point-of-use water treatment chemicals, aquatab and water guard. So what we are doing, we are supplying in the areas where there are cases of cholera. At the moment, that is what we are doing, supplying those water guards to those areas. But however, ideally we should be supplying at our clinic so that people can have easy access. But however, these water treatment chemicals are also found even in supermarkets. Water guard is found in supermarkets. So people can also access it from supermarkets, those who can afford.
Now, Dr. Vere, I hear you. You're saying that you are intensifying issues of refuse collection within the city. But it is quite different in Bulawayo because we have seen the city council, the new city council, taking steps to make sure that the city is very clean, which is quite commendable, if I should say so myself. But then to what extent is the city going to rely on residents to continuously clean up their own city? And if I were to bring it back here in the studio in Harare, why are we not making sure that residents also clean up after themselves like it is being done in Bulawayo? I'm going to start with you, Dr. Sibanda. I just need to hear from you. in the issue of how long are you going to allow residents to clean up the city, and also the issue of the water situation that is not up to scratch. What do you think needs to be done in order to, provide water, and as well as pipe maintenance, garbage collection, sewer maintenance, and so on and so forth?
Thank you for the question, but from my part, mine is to keep the city clean and to ensure that the water that people receive for drinking purposes is tested and is safe for drinking. The provision of water lies with the engineering services, but I am reliably informed by them that we do not have adequate water in our dams for various reasons, and we are hoping that the coming on stream of the Kwai Shangani Dam, which we hope is going to be soon, may alleviate that, such that we have adequate raw water for treatment. When the water is treated and gets to the people and gets to them on time, all the time, it has been proven to be safe. But it is only when water is in short supply and there's water shedding, whereby people get water sometimes and something happens to the pipes, which are now old, whenever they are empty and they are not pressurized and they have no water. That's when we have challenges. Then when the water returns, it finds that the sewer pipes, which are also old, are now filled up with solid waste. I mean, the previous liquid waste would then have solidified inside the pipes, and that will lead to generation of gas and eventually some pests, and that has been the challenge. Now, in terms of cleaning the city, we have tried to ensure that waste collection is improved, and recently, just last week, we commissioned the 2 refuse trucks, and we hope with further disbursements of funds, inclusive of devolution funds and better and improved collection of revenue, we may buy more refuse compactors and dispose of waste in a sanitary way, and hopefully avert challenges of litter lying all over and illegal dumping.
Now, like I did say, I want to bring it back here to the gentlemen who are in studio. Why are we not making sure that our residents are cleaning up after themselves? Why are we, apart from the National Cleaning Campaign Day, which happens like once every month, why are we not also tasking residents to clean up after themselves to ensure that the environment is as clean as they should want it to be?
Sorry. It's not that we are not encouraging them. We share with them the public health measures they need to take to prevent or to protect them from contracting diseases. But as Ministry of Health, we don't force people. It has to be voluntary. But most of these people have the knowledge that it's important to clean the environment to protect them from getting diseases. So this is what is happening, and we will continue to encourage them to do that. But like I've pointed out earlier on, it is a voluntary. Yes, some have the knowledge, but have a negative attitude. They think it's not their responsibility. They think because they are paying money to the municipalities, it's the responsibility of the municipality. But as a ministry, we are saying your health is your own responsibility.
Now, speaking of municipalities, I do understand that they are the ones that run the cities, and the ministry doesn't have a hand in how municipalities do run the city. But I'm just curious to know that as a ministry, what kind of partnerships are you undertaking with some various municipalities across the country to ensure that you address the root causes of these cholera outbreaks? Dr. Piri, if you could just answer that.
Probably, I'll take this opportunity to highlight to you that the Minister of Health and the government of Zimbabwe is a 10-year roadmap for cholera elimination, which was developed from 2018 to 2028. So we have a roadmap that was developed with the other stakeholders, including the municipalities, including the local Minister of Local Government, Minister of Finance, and the Minister of Health. Private-public partnership was also included in that partnership, whose secretariat is the High Life Foundation, which is an arm of Econet. So we are doing quite a lot in terms of engagement of local municipalities, engagement of cities, engagement of other stakeholders, so that we eliminate cholera by putting in measures that will enhance the elimination of cholera by year 2028.
Now, Dr. Vere, earlier you did say that the issue of boreholes might be the ones that are potentially causing these diseases because they're not providing safe water like they should be. My question then would be, when it comes to this issue of boreholes in urban areas, what sort of measures are you taking to ensure that the water is safe, if you do take any measures, that is?
Thank you very much. A very pertinent question. So when we test these boreholes, and that they are contaminated, we obviously need to make a decision of the way forward for that particular area. But obviously the dilemma that we face is that there might be no a viable alternative in that particular area. On municipal water is inadequate. So then if you then to decommission that particular borehole because it's contaminated with ether, sometimes you then leave people without any source of water. So what we are doing is we are then providing them with the point of use water treatment chemicals. Those are the Aquatest and the water guard that I talked about earlier on. We are also putting inline chlorinators on the boreholes, installing inline chlorinators on the boreholes, so that the inline chlorinators actually assist in purifying the water. It flows through it before it's collected by the residents. So, it's a catch-22 situation that we are in, where people think if a big borehole is contaminated, then we have to decommission it and stop its use. But sometimes we are not able to do that because of the non-availability of municipal water in Harare. What we have noticed is, despite municipal water looking as if it's not very clean, it is very safe actually for drinking. It has been found from the lab tests that have been done on municipal water samples that have been collected. They've been found to be clean and safe for drinking. So it's safer than the bore water.
Dr. Vere, you're saying the water is found to be clean, but then again, you have Morton Jeffrey Waterworks as well as these other water providers saying they do not have enough chemicals to make sure that the water is clean. So make it make sense to us how you're saying the water is clean when they do not have enough chemicals or enough to make sure that the water is clean like they do say.
Yes, so we understand that the water in Harare is heavily polluted, like what Ms. Naman just said. Water in Lake Chwele is heavily polluted. So we required so many chemicals in order for us to treat it so that it can become safe. This is why we are producing it in smaller quantities. Otherwise, we would have used those chemicals to treat lots and lots of water, but it won't be safe for residents. But we make sure that we treat it until it's safe. So this is why we end up with inadequate amounts of water that we treat. For estimate's sake, I think Harare uses around $3 million per month to treat water.
So then
which is quite a lot.
So now, Dr. Vere, this just basically means we really do not have a solution when it comes to water, clean, safe water for people, because if you're going to treat it in smaller amounts, it's a problem because people don't have the water. If you're going to treat it in large amounts, it's going to be dirty. It's also a problem. There's also a problem with the boreholes. They're being drilled in areas that are causing the disease. So to me, it seems like this problem really doesn't have a solution, if I should say so. But you know what, Dr. Vere, I'll let you think about this one while we take a breather. You're watching The Chase, Zimbabwe's premier current affairs program, right here on ZTN Prime. We'll be right back after this.
Every village has a scandal, and in each case, the chief has to restore sanity to his realm. From adultery the supernatural, avenging spirits, to disputed paternity.
Vabereki vako kuti ndiye murume wako, kumba kwenyu ndeupi?
Wavaiziva ndeuyu asi zvakapera.
Pari
zvino ndeuyu.
Ndeuyu?
Anozikamwa sose mukwasha kucha kwenyu.
Asati akakuzikamwa.
Catch all this intriguing reality on Village Court, 7 p.m. every Monday on ZTN Prime.
Welcome back. You are watching The Chase tonight. My name is Faith Nyaude. I am your host. Tonight we are talking about cholera. Is it back to haunt Zimbabwe? In studio, we are joined by Victor Nyamandi, also joined by Dr. Pili from the Ministry of Health and Childcare, as well as Mr. Paul Chinakizwa. Joining us via the phone is Dr. Michael Vere, who is from the city of Harare, as well as Dr. Edwin Mzingwane, who is the Director of Health Services from the city of Bulawayo, who is going to be joining us via Zoom. Now, Mr. Mzingwane, before the break, we're talking about how Harare might potentially not have a solution to clean water solutions. How is the situation like in Bulawayo? Is the water safe for people to drink directly from the taps? Are the municipalities providing clean water? Are the boreholes safe?
First and foremost, as a city, the golden rule is that borehole water you drink at your own risk. We can't guarantee the safety of the borehole water, but if you have tested it and found it to be safe, you can proceed, but you drink at your own risk, at your own peril. Then in terms of municipal water or city water, whenever it is around, people can safely drink from the tap. Occasionally, unfortunately, because of the water shedding program, whereby the pipes may go for days on end empty, there might be bacteria breeding inside the pipes whenever they are empty. So when the water returns, it becomes very difficult to guarantee its safety. But after a while, we know that if you let the first water run out and afterwards you can drink it safely. We have not had that challenge, but we know that when it returns after it had gone for a while, then you are likely to have contamination along the pipeline. That's what I can say.
Well, so now there is panic right now in the streets that 2008 is back again. Let us talk about the situation that is on the ground at the current moment. How is the country dealing with this outbreak? We're talking about surveillance, prevention, containment of the disease. How is the Ministry of Health having ensured that we're containing this disease?
Okay, thank you very much. We'll talk about the creation of awareness, and then maybe Dr. Piri will talk about activities that are being conducted related to surveillance. In terms of increasing knowledge, changing attitudes, addressing issues related to practices, social norms, and beliefs that people have, there are a lot of activities that are taking place throughout the country, whether there is cholera or not. Those that don't have cholera at the moment are preparing for the response. And then those who have cholera are addressing the outbreak. We have set up a committee that is known as the National Risk Communication and Community Engagement Committee, which is made up of government ministries, the United Nations family. We have local NGOs, international NGOs, faith-based organizations, and individuals that have an interest in communication. So the responsibility at the moment is multi-sectoral, because we know that it's something that cannot be addressed by the ministry on its own. Mm-hmm. Yes.
Now, on the surveillance side.
Okay.
Okay. Yeah. I think we work hand in hand with the WASH sector, work hand in hand with people with risk communication, community engagement. But in terms of surveillance, the ministry has a very robust surveillance system where we aim to detect each and every outbreak that is reported within 24 hours. And our teams on the ground, they are called the Rapid Response Team. They respond within 24 to 48 hours. And we aim to control this outbreak within 2 weeks. So we have a very, very robust surveillance system in place within the country. And the cases that are detected, they are treated at source. We set up cholera treatment camps there in the community and respond to the outbreaks there in the community.
Okay.
Maybe to add on to that, we also have community feedback systems. So if a case occurs in the community, they can communicate with us. We have a toll-free line, 2019, which is manned 24/7. So if there are issues, they can report directly here, and then we can contact the district or the clinic where the case could have happened. Mm-hmm. Yes, and we work with community health workers in terms of gathering information from the community, which they pass on to the next health facility.
So now what I'm hearing is you are doing all you can to ensure that you spread the message, you spread the awareness, you take a look at the cases, how they're evolving, how they're developing. How then are you dealing with the cases when they do, let's say, come up or pop up within the apostolic sect? How are you dealing with that?
As the Risky Communication and Community Engagement Committee, we have engaged the apostolic sect. Yes, we are working with them. Just on Tuesday, we had a meeting with the leadership of the religious groups. 120 attended, drawn from different parts of the country, where we were educating them about cholera. They came up with their own plans on how we should be working together. And it's not only the apostolics. We in the meeting we had representatives of traditional healers. There was Zinata, Zinipa, Darerewa Zimu. We had the Muslim community, and then Zimbabwe Council of Churches, Yuda Caesar, Zimbabwe Catholic Bishops Conference. We also had the Evangelical Fellowship of Zimbabwe, and SDA. So we are trying to include everyone, and it's not the first time that we are working with them. They played a very important role during the COVID pandemic. Yes, they have the skills to educate others. They have the skills to offer spiritual support to those affected and infected.
So you did say that they came up with their own plans as to how you can be helping each other. I'm hoping the ministry will try and adopt them.
We, like I've pointed out, we are working with them. We will help them to put into motion the plans that they came up with. We tasked them to come up with plans depending on their ideologies. The Muslims believe in certain things that are different from the Christians. So for the Muslims, we will work according to their plan. For the Christians, we will work according to their plan. And for those who believe in traditional medicine, we also work according to their plan.
Now, I do understand that the Harare and Bulawayo councils control most of the clinics in their cities. What has been your response to the cases? Do your cities have enough staff and the capacity to deal with these cholera outbreaks? If I could come to you, Dr. Mzingwane.
I must say that of the 21 clinics that we have in the city, and inclusive of the infectious disease hospital, plus the infectious disease hospital, that's Stone Grove Hospital, our staffing levels are not ideal, especially on the nursing side. We all have seen the challenge of skills flight or brain drain, and our nurses have been leaving in great numbers. We are essentially functioning at about between 50 and 60% of the establishment, which really needs revision itself because it was set up somewhere in the 70s prior to more programs coming on stream, including CIF of HIV and non-communicable diseases. So we have challenges there in terms of staffing. But in terms of other caterers, we think we are reasonable staffed. We think the number of doctors, the number of environmental health practitioners are reasonably adequate for the challenges that we're facing.
Now, Dr. Vere, you, if I could come to you, let's take the municipal clinics here in Harare. Do we have enough staffing?
So thank you very much. I think we are not spared by the problem of staffing issues, especially the nursing division, where currently the city is working with a capacity of around 40%. And fortunately, we have had permission to hire local nurses from council. So we are covering some of the gaps using local nurses. However, our capacity for permanent staff at the moment is 40% in terms of nurses. In terms of the other cadres, we can't really complain. So it's mainly the nurses. Then the clinics in Harare are ready to attend to cholera patients. Every clinic is able to attend to the first 30 cases of cholera. So we have got consumables for cases. But for Harare, in addition, we do have a cholera treatment center. Centers at the District of Disease Hospital, what people usually call Nazareth, and also in Gainesville, we have got a cholera treatment center.
Now, Dr. Mzingwane, cholera prevention or containment measures have often lacked some sort of strictness. For example, we see the ones that characterize the COVID-19 lockdowns. Are you doing enough as authorities to make sure that you discourage large gatherings and hotspots, to encourage non-shaking of hands, you encourage washing of hands, fruits, drinking safe water, and all those other nitty-gritties? What has been your approach in considering the type of disease that we're dealing with at the current moment?
I think the first statement is that we do not have hotspots within the city that we have mapped out, but we're in constant surveillance to see where we are likely to have cholera, because we have had areas that are affected by water supply challenges, and these have been prone to other diarrheal diseases in the past. So we're monitoring those. Our risk communication messages have always enforced hygiene issues, inclusive of washing of hands. The other challenge of gatherings, shaking of hands, and other practices are very difficult to change because they're ingrained in the people's way of lives. So that has given us quite a challenge there. But let me say that with the messages gone out, both through electronic, print, and all other media, to ensure that people are reached with the message that there is cholera out there, and we've had partners assisting us in doing so. We have also even targeted schools. We have worked with other ministries to do so. So I think this is how far we have gone. Of course, we still have challenges with the case management, especially in Thorncliffe Hospital. If we were to have anything above 100 cases, we are kind of ready for first 100 cases without asking for external help. But after 100 cases, we think we'll have challenges.
Now, I'll come back to the gentleman in studio. To what extent are we considering cholera an emergency here in Harare? Dr. Piri, if you could take that.
Any disease that spreads, that is a potential to spread between people, it is always been an emergency, and it has to be treated as such. When people are being affected, when people are dying, we worry very much, and we treat it as an emergency. An emergency is something that you need to put all your resources, mobilize resources, human and capital, to make sure that you mitigate against that. That's what we would call as an emergency, because it has a potential to spread. So we've put in place mitigation measures as a ministry to try and contain these current outbreaks, including case management, health promotion, and WASH.
Speaking of pulling all your resources together to help fight this outbreak, what is the government's perspective on how effective has it been when it comes to General Hospital's response to cholera cases? I also understand that there's some talk of deployment of doctors to cholera treatment centers, and more staff are being deployed to these centers. You know, you're also setting up treatment camps and rehydration points. How efficient have the measures been?
For treatment of cholera, it's very important that you treat the cases at source. So we set up cholera treatment camps where the cases are being reported in the community, so that people don't have to walk kilometers to go to a health facility. But we also encourage those that are near health facilities to seek treatment early when they have cholera. So these treatment camps are manned by healthcare workers, nurses, environmental health practitioners, and others that help in the control of cholera. So the resources need to be mobilized, including the human resources. But like any other, like the cities have said, we are also overstretched in terms of nurses and all that. But nonetheless, we also use community health workers that have been trained to give treatment in the community, and they are doing quite a good job by providing oral rehydration points in the community where the cases are being emanating.
Now, health education is of paramount importance, especially if you're dealing with something like cholera. As a nation, are we doing enough really to try and ensure that we are providing education on hygiene from household level, dealing with issues to do with open defecation, which has become rampant even in urban areas now? It seems as if it's now become the source of open defecation. It seems as if we do not have proper, defecation areas anymore. Are you actually, as a ministry, what activities or what other things are you actively doing to ensure that, we try and mitigate this? I'm going to start with the ministry level, and we're going to go to council level, Dr. Vere, and we're also going to come to you, Dr. Sibanda in Blawayo, to make sure to just get how you are helping raise awareness on the dangers of cholera, its prevention and containment. We'll just keep it short and brief to make sure that everyone has something to say. I'll start here in studio.
Okay, thank you. We are carrying out community dialogues in the community to help them appreciate the importance of changing their behavior, because cholera is behavior related. We are also disseminating messages through print material. We have distributed over 60,000 posters. We are also engaging health center committees so that they take the lead at ward level in activities to do with the prevention of cholera. This activity of coming here to ZTN is another approach which we have taken to ensure that we reach as many people as possible with information on cholera. And the message which we have been always sending out was or is drink safe, clean water, use safe, clean water, wash your hands, eat food that has been cooked thoroughly, use toilets. Those are some of the messages we are disseminating. But it is important to note that awareness on its own will not give us the desired results. It has to be supported by an enabling environment. When I say you need to wash your hands, is the water available? Is the soap available? If I'm to advise you to use the toilet, is the toilet available? So we need knowledge, we need the safe water, we need the toilets if we are to completely eradicate this problem of cholera.
And now I want to hear from council perspective. Dr. Vere, what are you doing to actively make sure that you're making sure you're raising awareness on the dangers of cholera, its prevention and its containment?
Thank you very much. I think most of the activities have been mentioned on health promotion, but we are working closely with our partners in terms of health promotion activities. We are in Harare, we are also conducting community dialogues, especially engaging community leaders, church leaders, even councillors, politicians, in order to raise awareness among them, so that they can also then impart the knowledge to the residents of Harare. We also have what we call health promoters, equivalent of village health workers in the rural areas. Our food show soldiers, and they are going into the communities door to door, giving health education. And we've also actually trained them also to be able to identify cases within the community. And they also teach the communities to identify cases. We are also distributing what we call IEC material or education material, information and education materials on cholera in various centers and in our clinics, so that people can also read and be aware. And in our clinics, we are doing health sessions where we also give education when people are, especially in the mornings, when people actually a crowd in the morning at the clinics. As the speaker has already also said, I think the issue of knowledge, yes, we might teach them, but the environment, number one, is important, as well as a matching practice. But some people might actually know that they should wash before they eat. But even if the water is there, some people may choose not to even wash their hands, but the water probably is there. Soap is there, but people don't. So there needs to be a match between the knowledge and also the practices, so that we can the spread of cholera.
Now, Dr. Mzingwane, is that the case also in Bulawayo? Are you doing the same? Are you doing the same awareness programs, or is it a bit different over there?
Well, I would say we are doing pretty much the same awareness programs, except that our clinics, we managed to have some electronic boards or TV screens where we flight some videos. When patients are waiting for care, they may actually be viewing those videos, because sometimes Zimbabweans may be too lazy to read. Yes, they are very literate, but we know that they were very lazy to read. So they prefer to see audio visuals. Unfortunately, here and there, electricity may go, but if there is electricity and power, I think we play a lot of videos. There is a lot of playtime, and that we think has improved the awareness out there in the community.
Oh, it is the age of digitization after all. I would also like to believe that ministry, council and everyone else is also utilizing the use of social media to try and spread awareness. Now, let's talk about cholera vaccinations. I just want to hear, is there a rollout strategy? What is the issue regarding cholera vaccinations? Any gentleman in studio wants to take that?
Probably, yes, we'll talk about the oral cholera vaccine that is can be procured internationally through WHO. There's a task force that coordinates that. And as we speak, Zimbabwe is in the process of doing the application so that we can submit to the global task force for cholera control and have a vaccine given. But vaccine is never the prevention. It's never it's never been the golden standard. And like Mr. Chinagda said, it's very important that we provide safe water and the health education so that we avoid the spread of cholera. So as we speak in the world, there is a global shortage of the oral cholera vaccine. You might request as many doses, but you won't get the numbers that you might want. So there is a global shortage, because cholera is being reported in many parts of the world. But the ministry is in the process of submitting that application.
So, Dr. Msigwane, that's also the case of Blawa. You do not have any vaccines or vaccinations that are being rolled out to try and make sure you treat cholera in such a manner?
Yes, we do not have vaccines. We are waiting for national level to procure the vaccines internationally, like Dr. Piri has said, and then we'll map the people, the recipients, where they are physically and their profiles.
Now, before I let you go, Dr. Vere, do you might have anything you want to say in regards to cholera in less than a minute, in regards to the treatment, in regards to raising awareness, or anything that our viewers may particularly like to know?
Okay, maybe just a parting shot. I think people need to realize that they need to treat water regardless of source. And also to mention to the residents of Harare that diarrhea treatment in all our clinics is free at the moment. So please do not hesitate to visit any of our clinics within the city if you have got any signs of diarrhea, with or without vomiting. Thank you.
Well, that has been The Chase right here tonight on ZTN Prime. I was joined in studio by Dr. Phil, who is from Dr. Piri, rather, not Dr. Phil, who is from the Ministry of Health. We also had Mr. Victor Nyamandi. We also had Paul Chinakizwa. And we had Dr. Michael Vere from the city of Harare, who was joining us via the phone. We also had Dr. Edwin Mzingwane, who is the Director of Health Services from the city of Bulawayo. Tonight, we were talking, is cholera back to haunt us right here in Zimbabwe? The gentleman did assure us that, no, we are doing all we can to ensure that, you know what, we are making sure it's safe, it's sound. So that's it. You stay safe, you stay sound. I've been your host, Faith Nyaude, right here on The Chase, Zimbabwe's current affairs program on ZTN Prime. Good evening, pleasant viewing.